Hello, this is Dr. Jason McClellan from Hampton Veterinary Hospital, and I'd like to talk to you cat owners today about dental care for your cats. As we know, even though we here at veterinary hospitals like Hampton Vet treat dogs and cats, and they are very similar species in a lot of ways, there are also many differences between dogs and cats, as we both realize by living with them as well as caring for them. And one of them certainly is dental disease. While dogs are more similar to people as far as developing periodontal disease, as far as tartar developing on our teeth, under our gum lines, loosening our teeth, causing problems and bacterial infections, this does happen with cats, but typically happens in most cats in a very slow manner, not very quickly. It's not as a concern, certainly with, in general, or certainly with most younger cats. Every cat is different. However, the main issue we see in cats, and it typically in most situations happens at quite a young age, and even less than a year of age in older kittens, but certainly between 1 to 4 years of age specifically, is a dental issue called resorptive lesions, or feline resorptive lesions, or feline odontoclastic resorptive lesions, or FORLs. This is not a new medical issue. Veterinarians have known about resorptive lesions for decades, and unfortunately no one's been able to figure out what is the cause. It has not been linked to a viral infection or an infectious cause, and it hasn't been linked to any nutritional deficiencies as of yet. More likely than not, we assume it's genetic. Roughly about 1/3 of cats develop resorptive lesions. Your veterinarian, through a regular thorough oral examination during their regular wellness exams or any typical examination, should be able to identify the small changes that we can see that indicate a much bigger issue going on underneath the gum line with cats that have resorptive lesions. Typically, it starts with just a little bit of redness of the gums around certain particular teeth, or sometimes we can actually see these resorptive lesions. There are holes that erode into the tooth itself, either on the crown, on the part you can see, or on the root, which we can only see by taking x-rays of the roots under anesthesia during a dental procedure. So when appropriate, your veterinarian will recommend dental cleaning and evaluation to see whether or not your cat has underlying resorptive lesions. These painful lesions your cat deals with much better than we do. They hide their pain and deal with it much better, but they still feel pain nonetheless. We feel that they shouldn't have to deal with pain, so we recommend doing dental procedures to extract teeth with painful resorptive lesions before they become more painful over time, that eventually they will fracture out of the cat's mouth, which we don't want to have happen and want to deal with appropriately. So while we don't have a prevention to prevent resorptive lesions from happening, we do have techniques and ways to less painfully and effectively and safely remove and extract painful teeth with resorptive lesions. And we do that quite regularly here at Hampton Veterinary Hospital. Cats do well with removing those certain teeth, or sometimes it has to be all their teeth, and people wonder how they eat. And they eat great. They eat especially soft canned food or soft and dry food quite well, and they feel better and they're happier, and I hear this time and time again. So when your veterinarian recommends that your cat may need or definitely needs tooth extractions, realize we're doing so to help make your cat feel much, much better and live a happier life. So while young cats might not develop as many medical issues as older cats, they develop dental issues. So that's one of the major things in younger cats that we look for and recommend strongly addressing when appropriate, because we want your cats to be happy and healthy just like you do. If you have any questions, as always, feel free to reach out to your veterinarian or veterinarians or your staff here at Hampton Veterinary Hospital. We'll be more than happy to help you out and answer any questions that you have. Okay, take care.